So I'm back on coronavirus. Our case counts are level or rising, so we need to continue to be careful. Here are the numbers. Since this time yesterday, we've identified 312 new cases of the coronavirus in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed case count of 117,768 since the beginning of the epidemic, and an additional 61 probable cases diagnosed by rapid antigen tests. So for the past week, we averaged 262 cases per day. That's PCR and antigen combined. And so far, we expect that number to rise. And of those people tested, 5.0% were testing positive. And for comparison, the week before, we averaged 275 cases per day, and 3.9% of the tests were positive. So that's where we are in Philadelphia. And around us, our case counts are either level or they're rising in Delaware, New Jersey, New York, and New England. As far as deaths, we have 40 new deaths identified today, bringing us to a total of 3,217 since the beginning of the epidemic. Now, many of these deaths were identified from past weeks. If you actually look at the date of death, the number of deaths per week has been gradually declining. We were at about 40 to 50 per week in early February. We're down to about 25 to 30 per week in later February. Put that in context, the worst week of the epidemic, we were about 250 per week. And the best weeks back in late summer, we were less than 10 per week. Now let me move on to vaccination. Our supply of doses of vaccine continues to grow. Allocated to us last week for delivery this week were 22,000 first doses of the Pfizer vaccine. That's an increase of about 2,300 doses from the week before, and 15,600 first doses of the Moderna vaccine, and that's the same as the week before. In addition, there were first doses delivered to pharmacy chains directly by the federal government. I don't have an exact number for that, but it was approximately 6,000. So if you put that together, it's about 41,000 total first doses arriving in the city. That's up from about 20,000 just a few weeks ago. Now, in addition to that, though, there's vaccine that is being delivered directly to the team that is doing the vaccination at the Center City Vaccination Center. And about 6,000 people per day, that's about 42,000 doses per week that are going out through that channel. How are we doing as far as administration of vaccine overall? As of Monday evening, we reported vaccination on 368,000 people for their first doses and 142,000 people for their second doses. Now, launched yesterday, we have a new expanded dashboard on our website that gives you an update on our vaccination progress. It provides information on the doses administered and on the percent of the population that has now been vaccinated and on what vaccines are going out through different types of providers. One of the things you'll note on this is that so far, 68% of the vaccine that's been delivered by Philadelphia providers is to Philadelphia residents, and the rest to non-Philadelphia residents, including essential workers who work in Philadelphia but may live in the suburbs. Note also that the dashboard does not include Philadelphia residents who were vaccinated in the suburbs or in New Jersey. So the data we have is somewhat incomplete. Of that data, though, it does show that overall 16% of Philadelphia residents are known to be partially vaccinated. So again, that's an underestimate. And it breaks down that percentage by age and by race. But for example, 38% of people in Philadelphia at the age of 75 or older are now known to be vaccinated. And again, that's an underestimate. But even that is enough to make a difference, we think, potentially in the mortality from this infection citywide. Now, for the week ending on March 7th, there were a total of 93,000 doses that were administered by all the providers combined, first and second doses combined. And that was up from 54,000 the week before. Now, for last week, it ended on Sunday. So far, we know of 96,000 doses administered. That's not complete. We expect to be over 100,000 doses by the time we get all of our data in. As far as eligibility for vaccine, we are still in phase 1B. Means the people who are eligible are frontline essential workers. Now people over the age of 65, we added 65 last week, and people who have high-risk medical conditions. Now, looking off in the future, we can say that we will move to phase 1C sometime in April. I can't say when, but sometime in April, we will move to phase 1C, and we'll move to phase 2 on May 1st. Now, phase 2 means that all adults will be eligible for vaccination. Now, eligible for vaccination doesn't mean that receiving that vaccination on May 1st. It'll still take some time to vaccinate all those people who become eligible as May 1st, but that is when we will open up eligibility to all adults. Back to what's happening today. So how is vaccine being made available? We now have 149 sites that are enrolled and receiving vaccine. That includes hospitals, a variety of clinics, and many pharmacies. In addition to all the sites that are run by these non-governmental entities, there are new community clinics that are being run by my department, the Department of Public Health, this week. Yesterday, we were at Simon Gratz High School at 1798 West Hunting Park in Nicetown. Tomorrow, we'll be at the Grand Yesha Ballroom at 2308 Snyder. And on Friday, we'll be at the EOM Athletic Association at 144 Moore in South Philadelphia. And the following week, there'll be 3 additional sites that will be open up run by city departments. Now, for next Tuesday, Thursday, and Saturday, we'll be doing second dose clinics at Martin Luther King Older Adult Center. That's this Tuesday, Thursday, and Saturday. We're doing second dose clinics at Martin Luther King Older Adult Center, Community Academy, and the University of Sciences. Now, just notice is at some of our sites, the number of advance appointments have been low, been lower than the number of appointments available to us. And we don't want those vaccination opportunities to go unused. So we began last Saturday taking eligible walk-ins in the Martin Luther King Older Adult Center and at Simon Gratz. We did take eligible walk-ins from the neighborhood in order to use up the vaccination opportunities that we had. At these clinics, we will continue to invite people from the database first, and to the extent that appointments are still available, we may allow people after that to come in without appointments. I should say, to the extent that appointments are still available. We know that for some of the clinics later this week, appointments are not available. So this will not necessarily be at every clinic. And I could use some help from the media here. In some cases, the message is getting out that all of our clinics are walk-up, and that's not true. And we don't want people showing up at our clinics assuming that they can get vaccinated if they don't have an appointment. We will allow walk-ups only if appointments are still available, and we'll get the message if they are. And I should note also that we're finishing a cycle of first dose clinics in the community, and then we'll be doing second doses for people who were vaccinated with those first doses 3 weeks earlier. Those second dose clinics are for people vaccinated there 3 weeks early only. We won't be taking walk-up appointments at those clinics. Now let me move on to the Center City Convention Center, Center City Vaccination Center at the Convention Center. This clinic is now close to hitting the target of 6,000 vaccinations per day. So it's been very successful in that regard. Overall, 79,000 people have been vaccinated since the Convention Center opened as through yesterday. People who have been invited are people who are in our database, vaccine interest, who are eligible under phase 1A or 1B criteria. That includes people 65 plus, people with high-risk medical conditions, and frontline essential workers. And for invitations, we've been inviting people citywide, but we've been oversampling people in the less vaccinated zip codes. Most people have been invited by email, some have been invited by phone, and some have been in referral from community-based organizations. Now, we are still having problems underrepresenting African Americans and Hispanic Philadelphia residents in the people who are being vaccinated at that Center City clinic. Overall, of the people vaccinated through all the days so far, 13% have been African American and 11% Hispanic. Those percentages are much lower than the percentage of the population as a whole. Now, related to that, we're also underrepresenting people in the under-vaccinated zip codes. In fact, vaccination rates are almost 4 times higher in the highest vaccinated zip codes than in the lowest vaccinated zip codes. And we're also seeing at the same time that our invitations by email and by phone are not always leading to filled appointment slots, especially from the under-vaccinated zip codes. Now, we know that getting an appointment is a barrier for many people. It's complicated to schedule an appointment, and if your life has many challenges to it, you may not be able to make an appointment that you've scheduled. So we want to make it easy as easy as possible for people to get vaccinated. So starting tomorrow, for the next 6 days at the Convention Center, that's March 17th through March 22nd, we will be doing a hybrid model. There'll be 3,000 scheduled appointments for people who are eligible under phase 1A or 1B criteria citywide who are in our vaccine interest database. And we think that there's some 92,000 people in that database, and everyone in that database will receive an invitation for at least 2 different days to schedule an appointment. In addition to that, there'll be 3,000 slots that we're going to call open access slots, where no appointment is needed, but not for everyone. These are strictly just for people who live in the 22 zip codes that are the most under-vaccinated, the lowest vaccinated 22 zip codes in the city, who are eligible based on age, medical conditions, or employment. Now, in addition to that, to make it easy for people to be vaccinated, we're going to be offering assistance in transportation from those under-vaccinated areas of the city, 2 days at a time. So there'll be 2 days where we're going to be providing assistance in transportation from West and Southwest Philadelphia, 2 days in North Philadelphia, and 2 days in areas of the Northeast and Lower Northeast that are the most under-vaccinated. The assistance is going to be through CCT service and free transit passes. And there are details on how this transportation will work in our press release. So what does this mean for people who want to be vaccinated? Message right now for everyone is still the same. The first thing to do is to go to our database, www.phila.gov/vaccine-interest, and put your name into our database. If you don't have internet, call 311, and they'll put you into our database. That will give you an opportunity to be directed to multiple vaccination opportunities, not just the convention center, but other opportunities as well. Or if there are people who live in the designated zip codes, Philadelphia residents only in those 22 lowest vaccinated zip codes, who are also eligible by being over 65 or having a high-risk medical condition, you don't need an appointment to get vaccinated at the convention center. Just to remind people what those high-risk medical conditions are, they include heart disease, diabetes, and obesity. And by that I mean a body mass index above 30. Now, there's a complete list of the high-risk medical conditions on our website and will be in our press release. People who want to try to go there without an appointment can come between 8 a.m. and 5 p.m. any day from Wednesday the 17th through Monday the 22nd. Okay, 8 a.m. to 5 p.m. any day Wednesday the 17th through Monday the 22nd. People should bring evidence of their address to show that they do live in those targeted zip codes, like an ID or a bill or any piece of mail. Now, I should note that if you're from Philadelphia, but you're not from the 22 designated zip codes, and you come there without an appointment, you'll be assisted in getting into the database for a future appointment. You'll not be able to get vaccinated that day. And if you're not a resident of Philadelphia and you don't have an appointment, you'll be politely turned away. Now, for people who are from those 22 zip codes, who do come without an appointment, expect that you may have to wait. And you may have to wait outdoors, so come dressed for the cold and be prepared. If there are too many people that come, you may be asked to come back another day. So I know it's a complicated message, and I could use help from the media to be really clear on what to expect if people do try to come there without an appointment. Now moving on to our safer at home restrictions. Yesterday, Governor Wolf announced an easing of restrictions statewide in Pennsylvania, effective Sunday, April 4th. It will allow alcohol sales at restaurants, not in the context of meals. It'll remove the 11 p.m. curfew for restaurants, and expand the indoor dining capacity to 75% for restaurants that self-certify to certain safety precautions, although they're still encouraging outdoor dining. And gyms and theaters and malls and casinos will be allowed to go up to 75% capacity. Indoor events allowed to go up to 25% occupancy, and outdoor events up to 50% occupancy, as long as people maintain the 6-foot distance. So that leads to a question about what we will allow here in the Philadelphia, in the city of Philadelphia. We're still concerned about the high and possibly rising COVID rates. Our numbers are still quite high. And so we're going to review this information, what the governor is allowing, which just came out yesterday, and we'll determine what restrictions will be appropriate to continue here in Philadelphia. We'll come back at a future press conference to detail that. Finally, just to remind people that overall, there's a lot of reason to be optimistic right now. But that optimism is really over the next few months. Today, the epidemic is still here, and it's still deadly. So I want to remind people, don't let your guard down too early. To use the football analogy, don't fumble the ball on the 5-yard line. Wear a mask, keep your distance, and avoid being around others. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And for reporters on the call, as you heard Dr. Farley asking for help in getting the word out with details of the new walk-in, walk-up opportunities at the Center City Vaccination Center. That press release that we just issued is linked in the chat, so you could get that. That has the complete list of zip codes that are whose residents are eligible for this walk-up opportunity. And it also includes the information Lauren just put in the chat regarding the special event permitting. And with that, we're now going to move to Q&A from members of the press, in addition to Tumar hanging around, as well as Rob Dubow, Sarah DeWolf, and Dr. Jill Bowen. Because of very limited time today, unfortunately, we're only going to have time for one round of questions, limited to the various topics we have covered. Let's start off now with Mitch Blocker of NBC 10.
Thank you, Mike. Good afternoon. Dr. Farley, I have a couple of questions for you, sir. Event planners, venue operators in Philadelphia say that they can hold events safely if allowed some capacity. Can you expand on what your plans are, what your thoughts are for allowing indoor group gatherings in the city?
So indoor gatherings are allowed right now with restrictions. What worries us the most is indoor gatherings where people are not wearing masks, particularly social gatherings like weddings and where people are maybe drinking and interacting very closely with each other for a prolonged time indoors. So we do prohibit these indoor gatherings, social gatherings where food and beverages are served. We do allow indoor gatherings where food and beverages are not served and where people are, sitting in seating where they're separated from each other. We will look at what we can allow safely as if case rates continue to go down and vaccination rates continue to go up. I know that people who plan events often plan them well out into the future. We're looking at if we can provide some sort of sense of what the future might look like given our vaccination rates. I'm not ready to announce anything today, but I'm hopeful that in the future I can say, okay, as of this date, we think we can allow this sort of event to open up.
I know you've talked a lot over the past year about concerns about the population density in Philadelphia and viral spread in the city as it relates to your mitigation efforts. But I'm curious about your thoughts about aligning Philadelphia fully with Pennsylvania in terms of reopenings. Do you think that will happen at some point?
Well, it would be convenient for us to simply align with Pennsylvania, but I am very concerned about the trend in the cases we're seeing right now. Case counts are not going down. If anything, they're going up. We're still having plenty of people die from this infection, and I'm worried that people are so eager to get back to normal that we may be opening up too quickly. So I'll simply say we're going to look at this, and if we feel that it's safe, it's okay for Philadelphia to be in alignment with Pennsylvania, we'll do that. That'll make it simpler for everyone. But if we feel that our residents need more protection, we may be more restrictive.
Is there a timeline for any updates, or is that just at your discretion?
I would hope that we'll have something, if not the end of this week, then by the press conference next week. The governor's changes go into effect April 4th. So we have a little bit of time for us to think about this.
And one question regarding the FEMA site. Is there any way that you'll be able to prevent, or is there a plan to prevent a mass rush of people who would be walking up? How would you deal with that?
So, first of all, we're trying to communicate clearly that it's only for certain zip codes and only for people who meet eligibility criteria. And then we're communicating to people that it may be crowded, and so they may have to wait, and they may be told to come back another day, they may be turned away. And then we'll have people monitoring this very closely on the scene. And if we find that we have many, many people come in the first few hours, we'll cut off the line and say no more people today and get a message out through a variety of channels, including text messages that we're full for today. Please don't come on down after that point.
All right. Thank you, Mitch. Let's go to Annie McCormick of 6ABC.
Hi, Dr. Farley. My question for you is also about the vaccination site. I just, again, want to make sure that I have clarity on it. In regards to the FEMA site, so at this point, it's only people within the certain zip codes that are allowed to walk up. I can just tell you this morning what I saw is we saw people walking up just hoping to get a vaccine that didn't have an appointment. There was also a woman who was from Montgomery County that does not work in Philadelphia. So she didn't actually meet the requirement. And it appeared that both of them actually got the vaccines. Is that something that you're okay with just because you want to get people inoculated? Or do you think now with this announcement you're making today that there's going to have to be some sort of stricter enforcement?
We do have people monitoring the door, and people can get in who have appointments if, and their appointments seem to be appropriate. I can say for the walk-up that we are going to be very careful about finding evidence that people do live in those zip codes and ask about medical eligibility criteria. So I can't explain each and every individual situation there, but we are trying very hard to, while we use up all the available appointments, we don't want to waste that resource to try to direct us to the appropriate people.
Okay, so the message to the people in the 22 zip codes is you can arrive without an appointment. And while you get there, you may be told you have to come back another day, but now you have an appointment. or you have to wait in line and you will be able to get vaccinated today?
Correct. Well, first, this is only for people who meet our phase 1A or 1B eligibility criteria from those 22 zip codes. So we're going to look for that criteria based on age and medical conditions, look for zip codes, and if they're eligible under both, then they may be able to get in and get vaccinated that day. That would be great. If we're oversubscribed that day, they may be scheduled for another day or otherwise directed to come back on another day.
Do you have a quota that you want to meet in regards to the amount of people in those zip codes where then you'll be able to open it up to broader zip codes?
I would like to see much, greater fraction of the people that we're vaccinating be in these underrepresented minority groups and also being those under-vaccinated zip codes. So, and right now the demand is high citywide. So I don't think for this 6-day period we're going to change that. I think we're going to stick with this policy unless we see problems with the policy in the next few days.
All right.
One last question for clarification.
So,
I have one last clarification, Mike, if you will let me. It has to do with the smaller city sites. Can you just explain that again, how this now applies to the smaller sites that you have opening?
For all the smaller sites, we are going to fill as many appointments as we can through invitations in the vaccine interest database. If it turns out that, as was the case in a couple of sites where there's open slots after we do all that, then we will put out a notice through community organizations and other organizations that there are open slots and people who meet eligibility criteria can come in. That may not happen. We may fill all of them. So for some of those clinics, they're all filled, and so that won't happen. But if it is available, we don't want to waste those slots. We'll put out an announcement often at the last minute that those appointments are available.
All right.
Thank you, Mike.
Sure. Let's go to David Melandra of Philly Sports Network.
My question's for Dr. Farley. So yesterday with Governor Wolf announcing these changes, have you given any thought about increased capacity for like sporting events for indoors and outdoors?
The governor's announcement didn't mention stadiums specifically or sporting events specifically. I want to see more details of the order and we'll look at that and see what if we think there's any implications for us here in Philadelphia. So it's just really too early for me to answer that question.
Okay, and have you had a chance to see how the Flyers and the Sixers have had, since they've had their fans back in, how things have gone so far?
I haven't had direct reports, but from what I've read about this, it looks like people have been fairly compliant with our standards, and that's a good thing.
And final thing for me is, right now, so the limits for Philadelphia are for 20% indoors and 15% indoors and 20% outdoors?
That's correct.
All right, thank you.
All right. Thank you there, David. We'll go to Johan Calhoun of Chalkbeat.
Thanks, Mike. I have 3 questions. First question is for Dr. Farley. How is the case count rising while access to the vaccine has increased?
Well, we vaccinated a lot of people, but it was still vaccinated a fairly small fraction of the people, overall 16%. So most people are still unvaccinated, and this virus can spread amongst all the other people who are unvaccinated. So that's why I want to really issue that warning. We haven't vaccinated enough people now to have an impact on the community-wide spread. So people still need to maintain their very careful restrictions.
Okay, second question is for Sarah DeWolf and possibly Tumar Alexander. The $1.3 billion that's gone to the school district, has there been discussion how the funding will be broken down? Will any of it be dedicated for HVAC and ventilation systems, which actually has been the highest concern for teachers returning to schools?
I think, like us, the district is in the process of figuring out how they'll use the money and what restrictions there are. There are some more restrictions on that money than the money that's coming to the city, so they're still going through that process.
Johan, you good?
Last question. I would like to get reflection from Dr. Farley on 1 year since schools closed due to COVID-19. What did you learn the most throughout this time in accommodating educators? And what do you know now that you wish you known March of last year, especially in dealing with the vaccine?
Those are pretty broad questions. I think I would just simply say that, as a pediatrician, and that I want our kids educated. I want them to be back in school as soon as possible. I think this has been very tough on kids to be out of school over the past year. And I do think that they can be back in school safely. And I'm very pleased that we now have vaccine offered to teachers. The CHOP vaccination process is moving along very well. And so I'm hopeful that we'll have more and more kids back in school.
Thank you.
Thank you, Johan. Let's go to Laura McChrystal of the Inquirer.
Hey, first I have a question for Rob Dubow. We heard last month that the predicted budget hole, could come with painful cuts in the next budget. Can you speak to whether the stimulus money will prevent the city from having to make cuts? Like, should we still expect to see a painful and slimmed down budget?
I think it would be much less painful than what we were looking at without this funding. As I said, we're still going through the process of seeing how this overlays with our budget and 5-year plan. So we're still early in that process, but we are in better shape than we were a week ago.
Okay. And then I have a couple questions for Dr. Farley. I'm wondering, is simply announcing these walk-up slots enough to really reach the targeted population and zip codes and improve racial equity, given that these people, might not have already to this point been signing up for whatever reason or getting appointments?
So there are a number of things that we're doing other than just announcing it here and making it available to make it easier for people, to make people aware of the opportunity, make it easier for them to come. So there's the press release. There are also robocalls going out from city council members to let people know about the opportunity. We have our Philly Counts team that is doing some phone banking to let people know about this. There's flyers being distributed. Information is going out through social media. Things are going out through text messaging. And then there are organizational partners that are doing things like distributing these transit passes. And so we hope through that in those targeted zip codes that more people hear about it and they'll take advantage of it. We don't know how many of them will. Going downtown is still a serious barrier, but we're doing everything we can to make it as easy as possible for them to come and get vaccinated.
Okay. And the gap between, according to the city's data, the gap between the percentage of white Philly residents who have been vaccinated as opposed to the percentage of the population of other races is actually widening, seemingly in large part due to the disparity at the convention center. What is your reaction to that, and what more can the city do?
Yeah, so we are very concerned about that. And so, this plan we announced today is one effort to try to deal with that. The other thing we did, we had a conversation with a very large number of community leaders last week to ask for their advice and their assistance in directing people to vaccination opportunities and advice at what else we ought to be doing. And I'd say the message that came out of that the most was to make vaccination more available closer to people's homes. And so we are doing what we can to do that. I don't have anything other than what we're talking about today to announce on that, but that's the other approach.
Thanks.
Thank you, Laura. Let's go now to David Merrill of Philadelphia Magazine.
Thanks. A couple questions for Dr. Farley. The first is about I'm curious if when you say you're oversampling lower zip codes to the FEMA clinic, but I think you said there was still a 4-to-1 gap in people actually receiving the shots from higher vax to lower vaccinated zip codes. I'm just curious, can you define a little bit more what you mean by oversampling in terms of like what the proportion of invites given out to the lower zip codes is compared to the higher zip codes? The ratio changes over time, but approximately people in the lowest zip codes were maybe twice as likely to be sampled on a per capita basis as people in the middle vaccination zip codes. Got it. And it's per capita. Okay, that was my other question.
Yes.
On the community health department clinics that you're running, I'm curious, for those that have unclaimed vaccine slots, is that a problem of not enough people actually being in the interest form for those zip codes to actually invite, or just not enough appointments being made from those who are receiving invites?
There are people to invite, but we send out invitations and they don't lead to appointments. We don't know if they didn't get the message, or if they've already been vaccinated, or if they just chose not to be vaccinated. But we know if we invite and they don't come, we want to make opportunity for that. And we did find that the 2 times we tried this, that there were people in those immediate neighborhoods that heard about this and took advantage of the opportunity.
Do you have any sense of what percentage of people invited from those zip codes are making appointments?
It's certainly less than 25% of those invited. Again, not necessarily because they chose not to. They may have already been vaccinated. We don't have all of their names matched. Maybe they didn't get the message, but it's a fairly low percentage of those invited actually end up leading to appointments.
And just my final question, I'm just wondering if you could give any comment on where sort of your thought process as far as where the health department is at in terms of the strategy of using the vaccine interest form as opposed to things like walk-up clinics. I'm asking in particular just because I'm curious if you're thinking if you think the vaccine interest form has worked well from an equity standpoint, just given what you mentioned about the lack of appointments at the health department clinics and then the sort of disparity in FEMA.
Yeah, I think that the vaccine interest form process has done a lot of good. It helps direct people to appointments. There's been a huge demand relative to supply, but it's not perfect. There are some people that getting their name in their database and then scheduling an appointment is a complicated process that they may not be able to get through. And so over the longer term, I would like to have more walk-in availability. Now, when the demand greatly exceeds supply, there's a risk of having walk-up availability that you'll have a huge crowd and that doesn't serve them well. And so we're right now in, I guess, something of a transitional process where we have some scheduled and some walk-up. And as we get closer to meeting demand, I think we'll probably be having more walk-up.
Great,
Thank you, David. We're going to go to Max Marin of Billy Penn.
Hi, questions for Dr. Farley. Just jumping on the oversampling question again. I mean, how long ago did you realize that the oversampling was not working based off of the city data, and why did you decide to wait until with just like 6 days left at the FEMA site to get first doses in? And do you think that this is enough to close the gap that you're seeking to close in just less than a week?
We've had the scheduling of appointments has been limited, as you probably know if you've been at these previous press conferences, by the fact that early on we had the links could be shared. And so we sent invitations and other people who were not invited were filling in appointments. Once we solved that problem, then it became clear that there were open appointments after the people who we were inviting had been invited. And so then that's when we came up with this plan. The FEMA site is not finished. It's only been there about 2 weeks. This now a third week. Then we'll go to second doses, but then there'll be more time after that. And then we have opportunities at our community sites. And we're going to be at this as long as it's necessary. I know it's not necessarily a race for people to be vaccinated. We simply want to get ultimately as many people vaccinated as possible. And so it's going to, we're going to continue to work at this.
Understood. Quickly, you mentioned the link sharing issue as one of the holdups. Has that been fixed?
There's a workaround, I should say. It's not perfect. The software has its limitations, but we've managed to work with the workaround.
Okay. The city recently sent out new guidance for providers about not pulling extra doses from vaccine vials. We've heard from some providers who are upset about this, feel like they're wasting some vaccine. Do you have any clarification on why this change was made?
This directive came down from the Centers for Disease Control. I have to get back to you with more detail, but I think that there's a problem that there are 6 doses you can get out of a vial. Some providers were able to try to get a 7th. If they do, then ultimately that leads to shortages of syringes or other problems. And so, whereas it may seem to help for that one patient, in the long run, it does hurt you.
Okay, last question for you, if you can bear with me. In the early stages of the vaccine rollout, there was a lot of concern about vaccine hesitancy in communities of color, and you had mentioned this recently as well. Is this still an issue that the health department is focused on, and how are you determining that?
We are concerned that is still an issue, and so we are also, while we're working on improving access, we're working on communicating with opinion leaders about how to communicate about the safety of the vaccine. And we are planning a media campaign to really try to get the message out to a much broader level about the safety and the importance of the vaccine.
All right, thank you, Max. Let's go to Mike Donofrio of the Philadelphia Tribune. Mike.
Here. Let's see here. So how does this federal funding plan, the stimulus, differ from the last federal assistance that Philadelphia received back, in the fallout from the 2008 crisis? Is this better, worse, in your opinion? I guess this is for Rob.
Yeah, this is different. We didn't get this type of huge influx of federal money for our operating budget back then. So that's a very big difference between now and back then.
Any other opinions about it? Better? Or do you think it'll help the city recover faster?
It definitely will help the city recover faster. If we had not received this money and we had to figure out how to balance a $450 million gap after having closed a $750 million gap, we would have had to make really painful decisions that would not, that would have hurt the city and the region's recovery. So in that way, this was desperately needed. And as I said before, we're still trying to figure out what it means in terms of what we have to do with the budget and 5-year plan, but this was desperately needed funding.
All right, and can you kind of put the stimulus program in perspective too, right? So not only is the city government going to get funding, the school district's going to get funding, but right, all these other households are now going to be eligible for this child tax credit, and all these other households are now going to be eligible for this $1,400 payment. How will that money kind of help the city recover in the long term, and more importantly, how will that new money help reduce poverty in the city?
Yeah, so it will give people money to spend, which will have, will help the economy recover more quickly than it would have. So that's really good for everyone in the city. So I mean, it's got, and you're right, it's got a lot of different elements. It's got the $1,400 checks. It's got the extension of unemployment. It's got rental assistance. It's got homeless assistance, money to the school district, infrastructure money. So really important things that will really help the economy. I don't know if you want to add anything, Sarah?
I think the only other two things I would add, I mean, you mentioned rental assistance. I think it will help keep people in their homes. And I think there's also expanded healthcare access, which seems like it will also be impactful.
Sorry, not to burn another question, but any specific thoughts about how that money could affect poverty specifically in Philadelphia? I mean, in many ways, in my perspective, it looks like a wish list of things to help address poverty throughout the city in a variety of ways. But from the administration standpoint, any thoughts again on specifically poverty and poverty reduction and what it could do?
So I think by having things like rental assistance, things like expanding SNAP, it's giving people more resources, which then will have a really positive impact on reducing poverty.
All right. I guess.
Thank you, Mike. We are pretty much out of time, but we have 4 people left with their hands raised. We're going to try to get to you, but please keep your questions as tight as possible. Let's go quickly to Jack Tomzik of Metro.
Yes, this first question's for Dr. Farley. I've been hearing of people who get invited to the convention center site and they log on to try to set up their appointment and they see there's no appointment and they got it for a specific day. What's happening there and what should those people do?
It is possible that we estimate how many of those folks are going to make an appointment. It's possible that we may have overestimates. Everybody who's in the database who's eligible over the next 6 days will be invited for at least 2 different days. So if they can't make one day, they may have an opportunity another day. And if they don't make either of those days, then other opportunities will be sent to them. As long as they're in that database, we will continue to invite them for vaccination opportunities.
Okay, and this is for Rob DeBoe. Do you have an estimate? You talked about the $450 million budget deficit. I mean, does this cut this in half? Does it cut it by a third? How much impact does it make on the budget deficit?
Yeah, so we're going through that process right now to understand what this money means for not just FY22, but for our 5-year plan. So the money is, the way the act is spread out, we get the money in 2 tranches, one in a couple of months and then one in a year. And we have until the end of calendar 24 to spend it. So it's early in our process, so I can't give you kind of the exact ratio you're talking about, but we are working through that process. And by the time we submit the budget on April 15th, we'll have that all detailed.
Thanks. One more quick question.
Jack, you there? We lost you. All right, Jack, we'll see if we can go back to you, but let's go to Martin Pratt of Philly YBN.
Thank you. Dr. Farley, can you explain a little bit about the process to find out if you're a part of the 22 zip codes, and also where do people go to get their appointment?
The 22 zip codes, I won't read them all off, but they're in the press release that's going out and they're in the chat.
Okay.
And they're in Southwest Philly, West Philly, North Philly, and a little farther northeast. And if they're in that 22 zip codes, well, and anybody who wants an appointment should get their name in the database, and they'll be invited to schedule an appointment. But if for whatever reason they're not in the database, they don't get an appointment, if they're in the 22 zip codes and they are eligible based on their age or medical conditions, they can try just coming on down there to get come in as a walk-in, essentially. And if they do that, they may have to wait. Or if we're oversubscribed, they may be told to come back another day. But we're hoping that'll be an avenue for people who, for whatever reason, couldn't schedule appointments to still get vaccinated.
Excellent, thank you. And lastly, this has been a trying 12 months, and you have definitely shepherded the city through a lot of stuff. Any thoughts on report card for the city and Department of Health? Like, I know that we were considered in the top 10 cities in the country for wearing a mask. How would you rate, Philly going through this trying, unprecedented pandemic?
I'm so involved in dealing with the issues moment to moment that I haven't had the chance to step back and sort of assess how well we've done. It's not me, but the entire city. I can say that we've got a lot of great professionals that are working really hard. I've been working nonstop for a year on this, and we've tried the best we can. And I can also say that after some very tough times for everyone in the city, that I really have optimism now that we're going to be pulling our way out of this in the next few weeks and months.
Thank you very much.
Thank you, Martin. Let's go quickly to Brian Mendoza of Telemundo. Brian?
Hello there. If Armando can help me translate these questions. Armando, se informó que la ciudad levantará la prohibición de los eventos al aire libre y que comenzará a aceptar solicitudes desde el día de hoy. ¿Se puede dar más detalles sobre esto y hablar tal vez sobre el proceso de la revisión de las solicitudes y las restricciones, si las habrá, que vendrán con este levantamiento de la prohibición, como por ejemplo si se aprueba, se tendría que usar mascarillas al mismo tiempo y cuándo esto empezará?
Muy bien, Brian, muchas gracias. This question it was reported yesterday that the city will be lifting the ban on outdoor events and will start taking applications today. Can you elaborate and talk about the application review process and any restrictions that might come with it when the lifting of the ban proceeds? If they're going to be wearing masks or there's going to be limits on attendance, for instance?
So I think I need help from Tumar Alexander on that.
Yeah, so we are opening up the application process today. Along with that process, we'll have a requirement for folks to sort of submit a COVID safety plan to us, and that plan must be approved before we issue the permit. So we'll be ensuring that there's restrictions and processes in place to have folks put on safe events. Although we're opening the process today, it doesn't necessarily mean we'll be issuing permits starting tomorrow. We'll have a process to where our internal staff are reviewing those permits, ensuring that folks do have all the requirements in place and that we're communicating back and forth with them. There is some loss of capacity as it relates to some city services and some city material that event organizers need to understand and work with us and work with privately to secure in order to make their events a success.
Thank you. Brian, efectivamente, el proceso para solicitar permisos para tener los eventos al aire libre se abre el día de hoy. Sin embargo, esto es parte de un proceso que requiere que aquellos interesados presenten un plan de seguridad ante el COVID que tiene que ser aprobado antes de que se otorguen los permisos. Va a haber obviamente restricciones para ello porque es un proceso y el que se abra el día de hoy la toma de solicitudes no significa que se entreguen esos permisos el día de hoy. Nuestro plantel tiene que repasar cuáles son estas restricciones, cuáles son los requisitos y tiene que haber una conversación con los solicitantes para ver que ellos puedan cumplir con ello. Obviamente va a haber una pérdida de la capacidad total que se va a permitir y otras restricciones para asegurarnos de que reabran con éxito y que sea un éxito.
Entonces se tiene ese límite de una fecha tal vez para cuándo van a empezar los eventos.
Is there then a date associated with a time when events will be allowed, will start back up?
It'll vary between, we'll be reviewing applications between 30 and 90 days. So certainly can't say in particular, not knowing what events or what applications we have in the process. So I can't put a particular date or activity or just be able to announce that just yet until we see the applications that come in.
Estimamos, Brian, de que el proceso de revisión de estas solicitudes nos tome de 30 a 90 días y ese es un estimado. Por lo tanto, al no saber cuáles son los eventos ni los solicitantes que están presentando estos permisos o solicitudes de permisos, no puedo adelantar una fecha. Lo vamos a ver hacia el futuro.
Listo. La segunda pregunta. ¿Cuáles son los criterios para que los códigos postales se incluyan en estas ubicaciones de los sitios de vacunación de la ciudad? Por ejemplo, el código postal como el 19148 y 19147 tienen una comunidad de inmigrantes significativa, pero no están incluidos en esta lista donde las personas pueden obtener la vacuna.
This is probably a question better suited for Dr. Farley. What is the criteria for the inclusion of zip codes in the city vaccination site locations? There are zip codes such as 19148 and 19147 that have a significant immigrant community and they're not included.
We just looked at, based entirely on the current vaccination rate per capita. So these are the 22 zip codes that have the lowest vaccination rate per capita.
Esta determinación se hace en base a la tasa de vacunación per cápita en cada uno de los 22 códigos postales, Brian, y eso se hace en base a los que tienen los índices menores de vacunación.
All right, thank you, Brian. We are going to move finally to Pat Loeb of KYW.
Hi, Dr. Farley, do you have any theories on why cases are going up again?
You know, it's really unclear to me. It could be that people are just becoming complacent, letting down their guard. But what's odd is that the area of the country that is where these case rates are the highest right now is in the areas of the country where mask use is pretty high. New York, New Jersey, Connecticut, Massachusetts. These are not anti-mask places, and the areas of the country where people are putting away masks still have lower rates. And so it's possible that there's some variant of the virus in this region, or the epidemic always follows patterns that we can't fully explain. It's just now this is the time period it's here, and later on it'll be hot somewhere else. I think it's too early, but the fact remains that the case counts are high. If anything, that they're rising, and it's still deadly, and so we still need to be very careful about it.
Given that the case counts are rising, is this a good time to start permitting special events again?
I think the special events will be permitted with caution and off into the future when we hope vaccination rates are higher.
Okay, thank you.